Any questions?
Dr. Sam.
Okay, Manuel.
Who is speaking?
طيب. Doctor, the exam will be 1 hour or how 30 minutes?
The exam, so it will be 30 minutes long, and there are 35, no, it will be 50 minutes long. Yes, and there are 35, yes, 35 questions. I'll tell you about the form of the exam at the end of the session before we take it. Any more questions?
Doctor, sometimes my module site is lagging and I can't access, but I tried now and it goes well. But if in the exam it lag, I will send you the screenshot and tell you if anything.
Look, yes, if anything, some technical issues happen, so you may just start the test one more time. So I'll just adapt the, so you'll tell me and we'll solve this problem anyways.
Okay.
So we'll be in touch, so you'll be able to tell me about this. Okay, now let us go to the, yes, let's go to the slides. So as you can see, today we are going to speak about instructions. There are a lot of procedures in medical practice, like different kind of tests and some other procedures just to treat the patients. So where so different kind of equipment is involved, and so the practitioners need to know how to do this, and so there are some instructions that help medical practitioners to deal with these procedures and equipment. And so today we'll start speaking about this. And well, I would like to know if you can see the slide full screen. Now, I guess I need to refresh. Yes. Yes, now you can see it full screen, right? Hello.
Yes, doctor.
Okay. So in the chat, somebody, it's visible. Thank you. And for the feedback. And now, well, so there are some comments on the homework. You were given the task to watch the video and then to complete some information in the form about the video, some data about the patient actually and the nurse, and everything was okay. I see that the students just have seen the video, but in some papers there were some mysterious phrases that it was hard for me to just understand why the students wrote such phrases. Maybe because of the just kind of misunderstanding. Yes, and some students don't actually remember this symptom. So on the line, other symptoms. There were such phrases as you can see on the screenshots, like soft throat or okay, soft throat is okay. The student understands the location of the problem of pain, but if the student writes like source food, it's just ridiculous. And so you can see that this is the sore throat, one of the symptoms that shows helps the doctor to in diagnosis. Well, be careful with such things. You should understand everything, and if you have any problems with understanding, you should consult the dictionary so that you should be sure that you are writing the correct phrase. Well, do you have any questions on the home assignment? No questions. Mhm. Well, and let's go to our course. And so here you can see several pictures illustrating some situations in general practice and in medical practice, actually. And the task is to answer the questions that are here on this slide. The questions: what is happening in the pictures, and what do you think happens before and after this? So, well, who would like to say something about the first picture? What is happening in picture A? Yes, Anurin, please.
He's inviting the patient to sit on the chair where he could examine him.
Mhm. Exactly, yes. And what happened before? So this, what do you think?
He asks about what type of the problem he has and
Mhm.
describes the problem. After that, doctor begins to examine the patient. After the
Exactly.
patient, yes, after the patient had described his problem.
Mhm, mhm. Yes, you're right. And so the doctor has probably written some, has probably completed some case history form about the symptoms and conditions that the patient told him. Okay, great. What about picture B? So Abdelrahman, what can you say about picture B? Abdelrahman? Yes, I hear.
Is taking records of a patient, like age, name, or something,
Mhm.
and then they are present to be checked by the patient, I guess.
Mhm. Will you speak louder? The connection is not very good.
You see the doctors like taking records, or either maybe he's also writing, maybe the doctor is prescribing a medicine to the patient.
Mhm, mhm. Yes, it's
Then
Mhm.
after that, the patient will head down to the pharmacy to get those medicine.
Mhm. Yes, great. You're right. Yes. And you can see also a pile of other case histories of maybe of other patients on the table. Okay, what about picture C? Amar, what do you think of this picture? Amar, is Amar here?
Yes,
Mhm.
yes, I'm here. Okay, so
Who are the
I
people
think
and what are they doing?
I think they are doctors and they are training this
Mhm.
adult.
Mhm.
and they're training on CPR, I guess.
Okay. Mhm. Okay, maybe this senior doctor is showing, giving instruction on how to do some kind of procedure, and so teaching the junior doctors how to do this, and maybe maybe then they'll just try to do the same, just show how they've learned just this procedure. And so, okay, and there are 3 more pictures here on the next slide. The question is the same: what is happening in the picture and what's going to happen after, or what happened before this. And if we have a look at picture D, so let us listen to Isar.
Yes, doctor. About D,
D. Yes.
there is a patient and doctors, but the patient have a surgery.
Mm-hmm. Mm-hmm. Possible. Okay.
Just
And
he looking for his information, his health, how he is feeling now. Like this.
mhm, mhm. Okay. And where are the people? Where are they?
They are in like room for the patient to comfort him. This room should be a calm. There is no noisy in this room.
Mhm. Actually, this room is called ward, a ward. Yes. So where the
Ward.
patient can rest between the procedures. So in a hospital. Mhm. Great. Well, yes, and these people are just asking about the patient conditions, and maybe then they'll prescribe something to him, or some tests or medications. Okay, good. And so if we have a look at picture E, so who are the people? What are they doing? Abu Ali, can you answer this
Yes,
question?
doctor. The people is a doctor and a nurse, and about they are describing the situation of the patient and a medicine he will take.
Mhm, mhm. Yes, quite possible. Yes, so they are discussing some professional issues. Yes, Emma, what would you like to say?
No, I'm gonna answer the picture if
Okay, picture F, please, Emma. Mhm.
I am seeing 2 doctors are talking to each other. One of them is not wearing his a medical coat, so I think that his shift has ended because and he was working from a long time because he is yawning and I think he's tired. And he is giving the patient file or the patient history to the another doctor. So I think that the another doctor that his shift is begun now. Like they are one doctor is in the morning and other one working in the night, I think. So that's all.
Yes, exactly. They are changing the shifts. Yes, you are right. Mhm. Yes, good. Well, and so if we speak about, yes, what is happening in the pictures, so I've already said that the patients are in a ward, and this is the definition of this word. A ward is a separate room in a hospital, typically typical one allocated to a particular type of patient. I would like you to think about your experience in the ward for the first time. So can you tell us when you were in a ward for the first time, and what did you feel being there? So let us listen to Mohammed Ali. Mohammed Ali, hello. No reply. Maris. Noha, please. Noha, have you ever been in a ward? Yes, no, Noha. Noha, have you ever been in a hospital?
Actually, no, but if I know the name, I can speak about the word.
Okay, so what do you think? What do people feel when they are in a ward? Can you speak?
The doctors treat patients in like in a ward. They treat patients, and they plan to give a best treat, and when for the patient when they diagnose his or her condition well, and also they diagnose the condition of the patient in the ward. And they plan with each other, like sharing their information, the doctors, to form a best way to treat these patients during the surgical procedure.
Exactly. Okay, yes, okay, great. Well, and yes, this is what happens in a ward. So very good answer. And now, so there is another term, ward round. So the ward round is a visit of a doctor in a hospital to each of the patients in a ward, like we've seen in one of the pictures, like this is like picture D, a ward round. Mohammed's bed. Okay, and yes, this is the ward round that is which is done regularly in the morning, so that some doctors can discuss the conditions of the patient and the changes that are happening in the condition of the patients. And yes, Mohammed.
Sorry for being late.
Okay, so good morning. And well, if we speak about ward rounds, so here on this slide you can see the tips for a first ward round. First means for a junior doctor who goes on a ward round for the first time, or one of them who is beginning the ward rounds. And let us focus on these tips and the question, why do you think each tip is given? So if we read the tips now, let's listen to Rufaida, please. Tip A, read it, please.
Make sure you know the names of your patient and where they are.
So why is it important?
I think it shows respect to the patient, that you know everything about them.
Okay, yes, when you address a patient using their names. Okay, this is very important, but to show the respect. Any other reasons?
Doctor, not to mix between the patients.
Exactly. Yes, it's also very important. So the doctor understands the patient's problems, because he can see the notes, so the case history, and can see the information about this patient. Mhm. Okay, and so Tarek, please, line B, will you read it, please? Tarek, hello? No,
Yes, doctor. Yes, yes,
you are here, so
yes.
line B.
Find out from the bed managers if any patients have been moved and to where.
Mhm. Why is it important to do before the ward round?
It's important to know if there is beds for new patients.
Mhm. Mhm. And who is who in the ward, right? Where they are located. Okay,
Who is what?
so where the patients are located, right? Whether they are
Yes.
here or moved anywhere. Okay, so Emma, please, the next.
Yes, doctor, can you re-say the question, please? Because
Line C.
check all the case notes, investigation, and so no all on.
So the doctor, why should the doctor do this? Check the case notes.
First of all, he should investigate about the case, because if someone has, if he should investigate and take history patient, because if someone in his family has a problem in his heart disease, I think that will affect to the patient. Also, the doctor should know if someone should investigate, because if someone is poisoned, he should know why the reason he is poisoned, and also to give him a good treatment for that poison. And also he should take case notes, because I think if he forgets about something or he missed something, he will return to his notes and should think in a proper way or incorrect way to know what is the correct disease, because sometimes the disease can be similar to each other and we cannot know the difference between it. So there is a gaps. If he take notes, I think he gonna find what is the gap in the patient.
Yes, and doctor should check the investigations, because the tests can change the previous diagnosis, because the tests can give some extra information and help in the diagnosis and in the treatment. Well, very good answer, great. So now if we move to the next line, let us listen to Yasmin. Yasmin, hello.
Yes, I'm here.
Okay.
Number D, to invite a nurse who knows your patient to come on the ward rounds. It's important to invite the nurse who know the patient history and the chief complaint of the patient. Like don't have to invite a new one. And you need to tell her about the chief complaint and the history of the patient, like that.
You're right. Yes. Sometimes nurses, they spend more time with the patient, because they just do the procedures and tests, and they take care of the patient and give him or her prescribed medications, and they can give some useful information about the condition of the patient.
Yeah.
Okay, so and so the next is Hussam. Are you here?
Yeah, I'm here.
Okay, will you read the last line here, please?
The record case stories and result clearly inconsistent.
Why should doctors record the case histories in such a way?
The case history you mean about the patient life problem, if he have a problem in his life.
Okay. So, and the doctors should also think about the doctor who will just other doctors who can come to the ward just to give consultation, and so they'll be able to read this case history. So that is why it should be clear to the other doctors and to the nurses who follow the prescriptions to give medications to the patient. Well, now let us have a look at the next slide. We can move. Can we move? Okay, here is not yet the listening task. So, and now we are going to, yes, now we are going to listen to the comments that are given to the instructions we've just read, and we should complete the reasons given for each tip. And so we should write something after this phrase. We should write no more than 5 words for each gap. Now I'm going to turn on the recording and you'll tell me if you can hear.
Unit 3, Listening 1. Unit 3, Listening 1.
Can you hear?
There are many things.
Can you
Yes, we
hear?
can.
Okay. Now.
There are many things that will become obvious once you have done your first ward round, but I can give you a few tips that helped me on my first day. The first thing is, make sure you know the names of all your patients and where they are in the ward, as you want to demonstrate that you are familiar with your patients. The next tip is always check with the bed managers if any patients have been moved, and if so, where to, in order to avoid wasting time, especially the consultants, running around looking for patients. Also, make sure you have all the case notes, x-rays and so on hand so that you can refer to them quickly. It is useful to invite a nurse who knows your patients to come on rounds with you because they may be more knowledgeable about the patients on the ward than you are. As regards the case histories and results, record them clearly and concisely. In that way, you can access information easily.
And I think we can listen for the second time just to write, to be sure that we don't miss anything.
Unit 3, Listening 1.
There are many things that will become obvious once you have done your first ward round, but I can give you a few tips that helped me on my first day. The first thing is, make sure you know the names of all your patients and where they are in the ward, as you want to demonstrate that you are familiar with your patients. The next tip is always check with the bed managers if any patients have been moved, and if so, where to, in order to avoid wasting time, especially the consultants, running around looking for patients. Also, make sure you have all the case notes, x-rays and so on hand so that you can refer to them quickly. It is useful to invite a nurse who knows your patients to come on rounds with you because they may be more knowledgeable about the patients on the ward than you are. As regards the case histories and results, record them clearly and concisely. In that way, you can access information easily.
Oh. Well, what does she say about these tips? So what did you write in line A, Abdul Rahman?
For the first gap,
Mhm.
you need to know the names as you want to demonstrate that you are familiar with your patient.
With your patients. Yes, great. Well, the next line is for Amar.
The doctor need to know if the patient moved his room to avoid wasting time running around.
Avoid wasting time running around.
If the patient moved his room, and
Yes.
he need to know where he is.
Just running around looking for patients. Okay.
To
Well,
avoid.
yes, you should avoid wasting time running around looking for patients. You shouldn't just do this. Yes, you should avoid this. Okay. And now, Anurin, please, line C.
I should check the case notes so that I can be on the ward. In the ward. Yeah.
Actually, the tip from the, yes, here, check tip C, check that all the case notes, investigations are on the ward, so you can do what? What did she say about
The examination of the patient in the wards. I know the case of the patient.
She says
Problem with the patient.
so that you can refer to them quickly. Yes, so it should be there. They should be there. Okay. Well, now Isar, please, line D. So line D says invite a nurse who knows your patient.
Yes.
To come to the rounds because, yes.
Because they may be more knowledgeable about the patient on the ward.
About the patients on the ward than you are. Okay, and so the next is for Abu Ali. What did you write in E?
Record the case history. Because in that way you can get the result clearly.
Okay, so she actually says you can access into them easily. Yes. Well, okay. These are the tips for the first word round. Can you think
Unit 3.
Of any other additional advice that you can give to a colleague, a junior colleague? Or do you agree with these tips? Would you give the same tips? Or can you add anything? Mohammed Ali?
Oh, yes, doctor. Would you give the same tips of junior colleague in this situation? Yeah, I would give same advices. And also I may add something.
What?
For treating a doctor to his patient, maybe sometimes the doctor should talk to his patient to know him better. Talking not only about the illnesses, diseases, and the case of the patient. Maybe they can talk about different topic. And it will make the patient trust the doctor more.
Okay.
They will have better bond between them.
Great. Okay, yes. Now I think we can stop here and well, the connection is lagging. And mhm.